Good morning, everybody. Just want to take a minute or two with you and talk to you about what I would do if I had hypothyroid disease or Hashimoto's. So, a few things that I would do. It's not everything I would do, but just some things that you could start, you know, if I were you. And the first one is to find out your food intolerance. Makes a huge difference avoiding the food you're intolerant to and keeping it out of your diet for just reducing inflammation in general and morbid matter within your bloodstream. The next thing I would do is take this. So it is found that most people with hypothyroid are deficient in chromium. This contains chromium. It's called thyroid PX. This is what I would do if I were you. And it's kind of my safe way of saying this is what you should do, but I'm not your doctor, so, I have a lot of patients who take this, and you can take 1 to 4 capsules a day, depending on the severity of your issue and how much you trust your doctor in lowering your medication. Because I guarantee if you avoid your food intolerance and you take that, you're probably going to have to lower your thyroid medication, whether it's levothyroxine, Armour thyroid, NP thyroid, you name it, Synthroid, you're going to have to lower it. So just those 2 things alone. The next thing I would do is I would stop eating gluten. It just seems to be one of those things that creates a lot of problem for thyroid disease. Back to the thyroid PX that contains chromium. Some of the reasons why we might be deficient in chromium is other elements push out the level that we need in our body. And some of those things that actually can create hypothyroidism is fluoride. So using a different toothpaste that's going to strengthen your enamel. A new thing lately that dentists are even offering is hydroxyapatite toothpaste. So you could use that, and just any sort of heavy metal detox is going to be beneficial. But yeah, first thing, find your food intolerance. Second, take something with chromium. Consult your doctor about it, preferably naturopathic doctor, because they probably will know more about that. And then avoiding gluten. And then the last thing, with this picture behind me, eat like a bear. Bears eat simply. They don't have big, huge recipes because they can't. And they mono eat what's in season. So fish, berries, elk, moose. They do eat grains and nuts, but it's only in season. So just a few tips for those who have hypothyroid. You can also ask me questions. I'll convince you to become a patient. But I've seen it time and time again, and I am able to get people who have hypothyroid, even for 10, 20 years, off the medication they were put on simply because their lab report said they had hypothyroid. So I recommend those things, and hope you have a great rest of your day.